So I got a question from a viewer about wounds that just don't seem to be healing. So if you got like a cut on your hand or foot or something like that, or maybe just some kind of little scratch or a little wound that just doesn't seem to heal right, in this video I'm going to help you understand the variety of issues that can create this problem and steps you can take to turn it around. Let's jump in.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So in a video comment, we got a question from Tom that says, 8 months ago I got some scratches on my foot which are still visible today. Also 1 month ago I got a tiny scratch on my hand which still hasn't healed completely. I have bloating problems and I'm pretty sure my stomach is inflamed, but how should my body be able to heal the stomach when it can't even heal a small scratch? I thought it would be either related to low mineral protein levels or to a catabolic imbalance. Diabetes could be another cause, so I went keto 4 weeks ago, but the scratches still aren't healing. So let's dig into some of these things that Tom's talking about. And I don't know Tom's situation. Tom is not my client, so I don't know what he has going on. I'm not giving advice to Tom, but we can talk about some of these things in generalities. And I'm going to put some links in the description below to some of the medical information that I found on these topics that will allow you to dig into that a little bit more. But basically, when we're looking at wounds that need to heal, it's really about the immune system's response. It's an immune system function to allow that to heal. And not only is that part of the body rebuilding and repairing itself, but the immune system is also not only rebuilding, but also keeping that wound from becoming infected. So this is all about that immune response. And when we're looking at why wouldn't this be happening, we need to consider the fact that, well, the immune system might be having some troubles, or the immune system might be really occupied with some other problem. Maybe there's some other type of infection going on. Maybe there's even a digestive overgrowth or infection that's taking place. And a lot of those resources and a lot of that immune function is going towards dealing with this problem, and the person might not even know that they have that problem. So we'll come back to this in a second, but a big deal with this immune function is vitamin C. And this is often a problem when we're seeing people that are having trouble with things healing correctly. And it kind of works out that the only mammals that don't produce their own vitamin C are humans, primates, and guinea pigs. And maybe there was something else. I can't remember what it was. Maybe somebody will tell me in the comments. But most mammals actually produce their own vitamin C. And when they're producing this vitamin C, they also produce a lot of other cofactors that go along with that and allow the body to utilize that vitamin C. But we have to get our vitamin C from the food that we consume. It's really kind of a ripoff. So a lot of people will also supplement with vitamin C, but when you do that, if you pick up your vitamin C at like the drugstore or some kind of grocery store or some cheap vitamin C, it's almost always going to be in the form of vitamin C as ascorbic acid. And it's actually just a fraction of that whole vitamin C unit that the body uses when it comes to repairing situations and also immune functions. And the body uses vitamin C for just about any repair function that it has in the body. So the body needs a lot of vitamin C, and we kind of need to get it from the food that we're eating. The problem is if you're supplementing with some type of synthetic vitamin C, it doesn't include all the cofactors of that vitamin C that the body needs in order to use it. So as you take this vitamin C, the body's going to steal from all of its reserves to kind of put it together with that ascorbic acid so it can actually be used for the purposes that vitamin C will be used for. Now, ascorbic acid can be a valuable supplement for other purposes. We use it for a lot of things when it comes to digestion, maybe helping somebody get the stool moving or acidifying that intestinal tract a little bit. It can be very beneficial for those purposes. But when you're trying to lift the vitamin C level in the body, ascorbic acid isn't really going to do that for the long term. After about 2 weeks, most people have used up most of those backup resources that the body can put together with that ascorbic acid and then use it as a vitamin C source. So when you're supplementing with vitamin C, you really want a whole food source. And there's things that are great like acerola cherry powder or camu camu powder. And both of those include some sugars in them as well. So if a person's trying not to bring in a lot of sugar, we have a supplement that we use called BioC, and I'll just put a link in the description below so you can look at that and just see the ingredients. I'm not telling you to use that. I'm not saying that that's going to heal all of your wounds or anything like that. I just know you're going to ask, so I'm going to let you look at that so you can see the ingredients that we use with our clients when we're trying to actually lift the vitamin C level in the body. But this can be very important when it comes to healing something. And a lot of times when the body isn't healing correctly, it's because it doesn't have enough vitamin C, or all of its vitamin C is being directed towards some other problem, and it could be a problem that the person doesn't even know about. The next thing that's important to think about are nutritional resources that the body has available to it. And in order to rebuild the body, and you're going to rebuild the skin or any kind of damaged item on the body, you really need resources to do that. And the body uses vitamins and minerals and amino acids and micronutrients and trace minerals, and all these things have to come together to allow that body to rebuild. So if a person doesn't have enough resources, the body might not be able to rebuild and repair things the way that it's supposed to. And this is most often coming about because a person has digestive malfunctions, where they can't really break their food apart in a way that they can access all the minerals and nutrients in that food. So they may even be eating healthy food, but if they're having any digestive symptoms at all, that's a sign that they're not really breaking that food down and accessing the nutrients in that food. If you need to learn more about that, we'll put a link in the description below for our video on 20 signs you're not digesting your food correctly, and that may give you some insights into whether that's something you need to check out. Something else that Tom mentioned was what we call a catabolic imbalance. And it was Dr. Emmanuel Rivisi who helped us understand that the body has this natural circadian rhythm at the cellular level. And during the day, the body should be in what's called a catabolic state, where it's very good at creating energy and kind of keeping us going all day. And it also is good at breaking down tissues so that they can be rebuilt and renewed. And then at night, we should move into the anabolic state, where the body is very good at sleeping and resting, but also rebuilding and repairing. So we can see that both of these states are appropriate. There's benefits to both of those states. But the problem is, some people can get stuck in one of these states and not really move back and forth from day to night like they're supposed to. And if they can get stuck in one of these states, or maybe their body is just pushed way too far into one of these states, it can create a wide variety of health issues. Like if someone's really stuck in this anabolic state, we see a lot of constipation, because in this state the body sends too much water to the kidneys and not enough to the bowels. And if somebody's really stuck in this catabolic state, well, they can be stuck in this breaking down state. They're not moving back into this rebuild and repair state that the anabolic state is so good at. So if they're not moving into the state, the body may not be able to optimize its ability to rebuild and repair, and that could cause a situation where a wound would take much longer to heal. And one thing that can kind of confirm this is I'll put a link in the description below to a study that showed us that there was a strong correlation between people who were having insomnia issues and slow wound healing. Well, something we see a lot with this catabolic imbalance is insomnia. And if the person is stuck in this daytime state, it makes sense that they would have a hard time sleeping, because at the cellular level, the body's in this awake, go, go, go situation. Another issue that causes insomnia is sometimes resources being too low, so the body's kind of stressing out and like, hey, get out of bed and go do something about this. We're running out of stuff. We need to do all of our bodily functions. And that can be a different cause of insomnia. But both of those issues have the ability to restrict the body's ability to repair. So it's just interesting that this study showed such a strong correlation between an inability to sleep and an inability to heal wounds correctly. So if you think that this could be an issue for you, we'll put a link in the description below for our video on understanding a catabolic imbalance, and that'll help you understand how to look at just simple self-tests at home to get an idea if your body may be leaning way too far in that catabolic state. But this can be a problem for a lot of people when their body can't move into that rebuild and repair state. It makes sense that they might not be able to heal things the way that they're supposed to. Another issue can be high blood sugar, and it's very well documented that this can be problematic for diabetics. And Tom mentioned diabetes. I don't know if he actually has diabetes or he just said he was going keto because maybe he was getting close to that. I'm not really sure, but even an insulin resistant situation can really raise the blood sugar in the system, and that can create a lot of inflammation from all those insulin going way too high. And basically when they're looking at diabetes and that correlation between diabetes and slow wound healing, they're looking at things about like all the oxidative stress that can be created from that situation. But I don't want you to view it as like diabetes causes slow wound healing. I view it more as a situation of all the trouble that can be going on when diabetes is there. It's all the elevated sugars, it's all the elevated insulin creating all that inflammation that can create all this trouble. So if a person can take steps to correct those issues, then all of a sudden all that oxidative stress and all that inflammation would go way down. So I'm not going to dig too much into that in this video. We have a lot of videos on how to improve insulin resistance. I'll put some links in the description. But Tom mentioned, I went keto 4 weeks ago and these things still aren't healing. And for most people to really correct insulin resistance, you're not going to do it in a week and a half. It's going to take quite a long time. Most people need to work at it for 6 months, a year, or longer to really correct that insulin resistance issue. So using keto can be very effective to improve that situation. I don't feel like a person has to use keto to do that. There's other methods that do that. My book, Kick Your Fat in the Nuts, kind of walks a person through the steps to kind of bring down that insulin and correct that insulin resistance and improve any type of weight issue and stuff like that. It's available on Amazon, but I'll put a link in the description below so you can get the whole thing totally for free if you need some help kind of correcting these blood sugar type issues. But another thing when we're looking at blood sugar is that this can take us back up to this immune function. Because remember that anything restricting the immune system from functioning correctly could restrict the body's ability to repair and heal damaged systems in the body or on the body. We also hear a lot about different medications can slow the body's ability to heal. And a lot of people that are dealing with inflammation, that inflammation is a response. It's an immune response from the body trying to correct a problem, whether that be healing something that is damaged or trying to clean up some type of infection or some other problem. That inflammation is an immune response. So if we're taking some type of medication that gets rid of inflammation, it appears that a lot of those work in a way that is reducing the body's ability for that immune response to work correctly, and that's reducing the inflammation. And that's why you see so many of these warnings on these medications that say can delay healing or can increase infections. So we want to think about things that could be going on that could be reducing the body's ability to heal things. So you want to check with your doctor to see if any medications that you're taking might have that type of reaction. But another thing we want to think about is for the immune system to function correctly, it was Dr. Royal Lee who helped us understand that you have to have the right amount of calcium at the tissue level for the immune system to be able to work correctly. And there's a lot of scenarios where too much calcium will be pulled out of the tissues, and then the immune system doesn't even know that there's a problem because there's a signaling system that needs that calcium there in order for it to work correctly. We see a lot of issues where people will get things like cold sores, and when they use something like an amino acid like lysine that helps push calcium back down to the tissues, then all of a sudden those cold sores go away. It's because the immune system knows what's going on. It knows that there's a problem that it needs to keep in check, and it can handle that. But when too much calcium gets pulled out of those tissues, all of a sudden the immune system won't work the way that it's supposed to. So a problem with high blood sugar is that calcium likes to follow sugar. So if somebody has really high blood sugar levels, they could be pulling too much calcium out of those tissues, holding that calcium in the blood as it follows that sugar and not allowing the immune function to work like it should. We also see this with somebody taking too much vitamin D, and this confuses a lot of people. We really need vitamin D to bring calcium in from the intestinal tract so that that immune system can function. That's why vitamin D is so important for the immune system to function. But if somebody is using way too much, they not only pull in the calcium D from the intestinal tract, they'll pull calcium D into the bloodstream from everywhere and pull a lot of it out of the tissues, even pulling too much out of the tissues and creating some of those issues like we see when someone doesn't have enough calcium at that tissue level. So if that's freaking you out a little bit, we'll put a link in the description below for our video on who should stop using vitamin D, and then I'll show you some more insights into how to figure out if that's problematic for you. But you can see that there's a lot of different things that can turn off the body's ability to heal correctly. And I'm not going to be able to just give you an answer for that. It's kind of a ripoff, right? But you can see that each person might have different things going on that's restricting the body's ability to heal these things that are damaged. And another thing that we want to keep in mind is that we don't get to pick the body's priority. The body may be prioritizing something else over healing a scratch on your finger. There could be other things that are a higher priority to the body, and we may not even know that the body's going to war or doing some kind of major reconstruction situation, and we're just waiting for this thing on our finger to heal up. So we don't want to think that the body's so stupid. In most cases, it's a lot smarter than we are, and it may have priorities and other issues that are going on that are kind of putting this other stuff on the back burner. And you might need to do some work to see which one of these factors may be the biggest contributing situation for you. It might be different for you than it is from your friend or your neighbor, so it might take a little bit of work. And since this blood sugar issue can be so problematic, right now you can jump over and check out our video on how to improve insulin resistance if you feel like that's an issue for you. I can't wait to hear about your results.